Hello, everybody. I'm Ayan Mahmood, a project support officer with the Bolder Healthier Champions team. Today, I'll be talking to you about physical activity and behaviour change webinar. So, what is physical activity? It's all movement, including during leisure time, for transport to get to and from places and as part of a person's work. The type of questions posed could make people think about their own physical activity, such as um, what type of movement do you partake in daily? Do you know how much physical activity is necessary? What is your regular mode of transport, and do you have a specific favourite physical activity? So, what are the benefits of physical activity? The Chief Medical Officer said in 2019, if physical activity were a drug, we would refer to it as a miracle cure due to the great many illnesses it can prevent and help treat, such as dementia, type 2 diabetes, cardiovascular disease, and other mortality issues as well. So the other wider benefits of physical activity include having a viable working population for employment, increased business investment and development, increased academic attainment, reduced traffic congestion, and also, among other things, improved air quality. So why does physical activity matter? Physical inactivity is one of the top three drivers of premature mortality. It costs the UK more than 7.4 billion annually, and 900 million of that is just the NHS alone. Being active every day can reduce the risk of 40 different diseases, and being active daily can improve clinical outcomes and reduce symptoms for those living with diseases at every age. What are the guidelines? There are physical activity guidelines as per the UK Chief Medical Officer's report in the Gov on the Gov website. It has guidelines for physical activity for 1 to 5-year-olds, and it's recommended that they do 180 minutes of physical activity per day. There is guidance for physical activity for 8 to 18-year-olds for 60 minutes a day, and there's physical activity guidance for adults and older adults. They are suggested to 150 minutes per week or 75 minutes of vigorous activity exercise per week. So there are different intensity levels within physical activity. The first one would be moderate. Moderate intensity level of physical activity noticeably increases your heart rate and breathing rate. You may sweat, but you are still able to carry out a conversation. You can talk, but you can't sing, and you feel like you're exercising but not huffing and puffing. The NHS physical activity guidelines for adults suggest the aim is to be physically active every day, even if it's just light activity, and to do 150 minutes of moderate intensity exercise per week, and reduce the time spent sitting or lying down. There's also vigorous intensity is the activity done with a large amount of effort, resulting in a higher heart rate and quick breathing. It's difficult to make full sentences. Activities such as running, cycling, and tennis are usually classified as vigorous. The NHS physical activity guidance for adults suggests, again, the aim is to be physically active every day, even if it's just light activity, to do at least 75 minutes of vigorous intensity exercise a week, and reduce your time spent sitting or lying down. And finally, we have strength and balancing, which is strength training is a key component of overall health and fitness for everyone. It is recommended that strength and conditioning training should be done to the point where you need short rest before repeating the activity. This could include Pilates, yoga, weightlifting, gardening, or carrying in heavy shopping. The NHS physical activity guidelines for adults suggest the aim is to be physically active every day, even if it's just light activity. Do activities that improve strength, balance, and flexibility on at least 2 days in the week, and reduce your time spent sitting or lying down again. So here is a representation of the levels of physical activity in Birmingham. In dark blue, we have those that are inactive. that do less than 30 minutes of exercise, 30 minutes of exercise per week. Those in pink that are fairly active that do 30 to 149 minutes per week, and those in light blue that are active that do over 150 minutes a week of physical activity. So activities that improve aerobic capacity, balance, and bone health include running, um, ball exercises, yoga and tai chi, dance, Nordic walking, and cycling, amongst other things. So how active is Birmingham? 55% of adults in Birmingham are active. They spend at least 30 minutes of physical activity per day, and 42% of children are active within Birmingham and do up to 60 minutes of activities per day. What are the inequalities within Birmingham? So there are underprivileged groups. Inequalities in physical activity exist across a number of those underrepresented groups, for example, those with disabilities or long-term health conditions or certain ethnicities. Deprivation. Physical inactivity is strongly linked to deprivation. There's age, so you're more likely to be inactive if you're younger or an older person living within the city. And gender. Women and girls are likely to be less active. So there are barriers that people face when being physically active. And I'm going to talk about the barriers and how to overcome them. The first one would be a lack of time. So identify a suitable time slot for physical activity, make it a part of your routine, and take up exercises such as walking, jogging, or climbing the stairs, or walking or stretching between meetings at work. There's social support, the barrier of social support. So share an interest with physical activity with your friends, family, ask for support, or join groups that you can be physically active with other people. The lack of energy. Schedule your physical activity where you feel more energetic during the day. Convince yourself that if you give it a chance, physical activity will increase your energy level, then try it. The lack of motivation could be another barrier. Plan ahead, put it into your calendar, invite friends or family to join the exercise group. There is the fear of injury. You can overcome this by warming up and cooling down to prevent injury. Exercise appropriately for age, fitness level, and health status, and choose an activity that you can do safely, slowly increase the amount you do to grow confidence. There is the barrier of lack of skill. Select an activity that does not require new skills, such as walking, climbing the stairs, jogging, or taking a class, and then upskill. High cost and lack of activities. So select an activity that requires a minimal. Sorry. So select an activity that requires minimal expenses, such as walking, jogging, skipping. Identify inexpensive and convenient resources available to the community, and speak to your GP about referral programs. And finally, weather conditions. So develop a set regular activities that you can do regardless of the weather, such as dance, indoor swimming, skipping, and home activities such as indoor cycling or home exercise videos. So, physical activity and the COM-B model. Physical activity can benefit both physical and psychological health. The COM-B model, which is a behavior change model, can help us understand individual behavior by being physically active. Each day, you can be influenced by what we know, and what we can do, which is our capability, the people around us and our physical environment, which is our opportunity, and our beliefs and what we want, how we see ourselves, and how we regulate our emotions and our habits, which is our motivation. So, how can we be more active in Birmingham? Find the motivation to be more active. Do what makes you feel good, something that's fun and sociable. It increases your confidence and your self-esteem. It prevents poor health. It saves money and is good for the environment also. So how can we increase physical activity as individuals? Make small changes such as taking the stairs, incorporating walking or commuting for the school run. So lunch away from your desk at work, brisk a walk or a jog during TV adverts. So walking, running or cycling alone or with friends, taking group classes, having a personal trainer or doing sports that's organized or informally with friends and family. So here are opportunities to be more active within different environments within Birmingham. So there's the Active Wellbeing Society, and other places where you can find groups to join as well. So the advice is make use of the free activities in your local leisure centre, explore your local green spaces, learn to ride and increase cycle confidence with Active Wellbeing Society. Ditch the car for short journeys and save money on travel costs. Check if your workplace has the bike to work scheme. And here are some of the support available in Birmingham. The slide deck will be distributed, and you can follow things like the Park Run, Sport Birmingham, and Connect Sport. So bolder, healthier community champions. So what can we do to help? This is where the bolder, healthier champions come in. Your role as a bolder, healthier champion is to talk about the importance of taking up physical activity, to inform people how and when to be physically active, and continuously encourage them. Share these important health messages by distributing the information you have learned in your communities and connect people to resources that can help them or someone they know, whether on a website or through a helpline or an organization. And finally, a feedback to us. Is our information useful? What other information do you think would help? What else can we do to get the message across? And is there a particular topic that you'd like to hear from us on? Talking should always be done with the intention of helping connect people to the right support, not taking on the responsibility. Not taking on the responsibility of offering professional guidance. Always use approved information and try to remain neutral. Don't get personally involved with people you're trying to help. Here are some of the questions that you can ask members within your community. So, what do you talk about? Spot people who may need your support. Share messages and encourage people within your communities to take up physical activity and promote these webinars in your network. This is an example of how you can offer help without getting personally involved. You can offer brief and immediate support and find out what help is needed and then direct the person to the resources we have given you. By using the Act, Advise and Assist model. So here we've used an example of somebody who's trying to find information on physical activity. So you ask, have you visited your GP about physical activity across Birmingham? Have you got family or friends that you could be physically active with? And then you advise them on where to get information from, such as the NHS, the government, and the council websites. And if you're unsure, to speak to a health professional for support, and then act by signposting to different opportunities to be physically active across Birmingham. So Ellie, the bolder, healthier champion. Sometimes you can help someone best by offering practical support, especially if they're struggling to find time to do the research for information for themselves. So Ellie is a bolder, healthier champion who's recently attended the physical activity webinar. Simon has recently moved into her flat share and are both cooking dinner at home for the first time. Here is the dialogue that Ellie and Simon have, and Ellie signposts Simon to different physical activity in Birmingham. Here's a directory of resources that you can have a look at your own leisure. The slide deck will be distributed to you all. You are our eyes and our ears of the community. You're called to tell us where more help is needed and how best to provide it. Email us or connect through social media at any time. Thank you for being a bolder, healthier champion. We hope you're enjoying these sessions and enjoying promoting the positive health message um, to the community by supporting them. Improve their health and well-being. We want to say thank you for volunteering to be a bolder, healthier champion. Your role as a bolder, healthier champion is to share the information into your communities to encourage them and support their health and well-being. Our champions are advocates for important health messages in Birmingham just by distributing this information into a wide range of communities and networks. We support you through monthly themed webinars and tailored resource packs. We have previously covered mental health, diabetes, cost of living crisis. If you know someone who might be interested, please encourage them and find out more by either searching Bolder Healthier Champions Birmingham City Council or sharing the link with them when you receive the slide deck. And finally, thank you for joining us today. We couldn't do this without you.